What can I do about my under eyes? I'm 30 and my under eyes look awful. I hate the bags and the darkness. Is eye bag removal my only option? Or should I look at laser? Botox? Fillers?
Thank you for your question. You're 30 years old, you submitted a single photo, and you feel like the under eye bags and the darkness looks awful, and that you are questioning, is under eye bag surgery your only option, or can you do something like fillers, Botox, or laser? Well, I can certainly give you guidance as to how I approach this issue with my patients pretty much every day of my practice all day long. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and dealing with under-eye bags is something that we deal with all day long in our practice, as I mentioned earlier. So it's an interesting time when it comes to addressing this type of issue. And so before explaining what I would do, you first should at least have a sense of what the problem basically is. So when you see someone, whether they're younger or older, who has puffiness under the eyes that's present regardless of salt intake, allergies, sinus problems, well, that basically is an anatomic issue. And that anatomic issue is referred to as lower eyelid fat prolapse. Now, when you are dealing with lower eyelid fat prolapse, it basically means that fat that's normally around the eyes pushes forward and creates this bulge. Now, in the past, the only definitive procedure was a surgical procedure. And so a few years ago, with the advent of softer hyaluronic acid fillers, there became additional strategies such as ways to camouflage the presence of the under eye bag. So when I look at a patient who has a certain amount of fat prolapse, the question I ask myself is, first, is it small enough that I could camouflage the under eye bag with the placement of a filler? And how does that work? Well, when you look at the puffiness under the eye, adjacent to it is an area called the tear trough. And that area is like a valley that's next to a mountain. So the option of using a filler is to try to fill that valley just enough so that you can blend the area. Now, the upside and benefit of this is, of course, it's a limited procedure. It's an injectable procedure. It's done in an office setting. It's basically you're in and out. You come in, half hour later, it gets done, and you go home. And you can buy yourself some time before you were to need a surgical procedure. The downside also is that, of course, that because it is a procedure that works around the eyes, depending on the technique, you can get some swelling, you can get some lumpiness, you can get some bruising. And so it's almost like part of the downside of even considering surgery. Now, when it comes to the surgical option, which can be the most where you end up finally, is it's actually a fairly straightforward option, but it is something that you want to do when the time is right. And so typically for a 30-year-old like yourself, and without a physical exam, but basically as a general rule of thumb, I would do a procedure called the lower eyelid transconjunctival blepharoplasty. Transconjunctival blepharoplasty means that I'm basically approaching the fat pockets which have pushed forward, which is the underlying problem, and I sculpt those fat pockets to help them blend and not bulge out and create this area of puffiness. Now that is done under local anesthesia with light sedation, so the only difference is that there's a little bit of sedation. It's done in our office operating facility, but what's nice is you're not placed under general anesthesia. So when you try to come up with the real distinction between surgical procedure versus an injectable procedure, the differences become less significant when it's done in this approach. And I did this intentionally so that our patients would feel comfortable. And we do our procedures in our Joint Commission certified facilities in our office. So essentially, instead of going to an exam room, they go into our operating suite, and before you know it, the procedure is done. Now, one more element that I do use, whether it's with the injectable filler or with surgery, is that for the dark circles or the quality of the skin, we will often do something called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it is a concentration of the wound healing and growth factors in your blood that does help with improving the skin quality, including the appearance and discoloration, as well as from fine lines and wrinkles. So again, there is certainly an art to approaching this problem. And what I would suggest is you meet with doctors who do both procedures. A lot of times people have come to us, and they come to us from all over the world with well-meaning doctors overfilling the under eye area with filler to the point where it makes their bags look much worse, or having filler done at a certain time frame, and then the appearance of what's called the Tyndall effect, or a bluish hue that they don't understand why it's still there, even though they had the filler a long time ago. So there is still an art to doing this, and there's an art to whether you do the filler or whether you do the surgery. But I think that when you go to a doctor who can do both, then you actually will get more likely a fair, unbiased opinion. A lot of times very well-meaning non-surgeons just want to place fillers when fillers may not be the ideal option, and I've seen that happen, too many times to count. But nonetheless, it is important that you be comfortable with the doctor who you're going to seek advice from, and look at their results and get a sense of what makes sense for you. One of the nice things about even considering doing fillers first is at least you can see what it looks like, because if you're able to be comfortable with the fillers, then you might be in a good place, and you may be able to buy some time before you do move forward with surgery. So again, move forward with at least investigating this with qualified, experienced cosmetic surgeons, and who do a lot of work with eyes, and see where you're comfortable. I mean, there is also differentiation in the techniques, whether they do direct injection, or what I do with a lot of my patients, I use something called blunt cannulas, and use different techniques that I've refined over years of doing this, and trying to make it as minimally traumatic as possible and looking as natural as possible. So I hope that was helpful. I wish you the best of luck. Thank you for your question.